Okay, so good afternoon, viewers. Welcome to another episode of Monitor Your Health, a program where we, enlighten the public on topical medical situation around the world. Today is the World Blood Donors Day, and we think it's quite appropriate for us to bring an hematologist who can talk us through what the program is all about. So we have with me here today, Dr. Adenike Idayat Durotoye, a consultant hematologist. You're welcome, Dr. Durotoye.
Thank you, sir, Dr. Ogunremi, and viewers at home. Good evening, everybody.
Thank you so much. We really appreciate your time. Please, can you introduce yourself to us?
I am Dr. Durotoye Idayat Adenike. I am a consultant hematologist. I work with the University of Ilorin Teaching Hospital. Then I also work with the University of Ilorin as a lecturer at the College of Health Sciences, University of Ilorin. Thank you, sir.
Thank you so much. So now we know that today is the World Blood Donors Day. What does that really mean?
Thank you, sir. I want to say that today, June 14th, is being set aside by the World Health Organization to mark this day, tag World Blood Donor Day. The day is set aside to appreciate our voluntary blood donor all over the world, and also to encourage other well-meaning Nigerians or everybody all over the world to join the race and be a voluntary blood donor. So today we are celebrating our voluntary blood donors, and we are also advocating that many people should come on board to be a voluntary blood donor.
Okay. Thank you so much. So it's a particular day set aside for voluntary blood donors to celebrate them and then to encourage
all over the world, 14th of June, every year. Every year.
So what our viewers probably will be thinking is, why is blood donation that important? Why is it important?
Yes, I want to say that blood is life. Without blood, there is no life. We are here this evening because we have blood running in our system, because blood is very essential for survival. Inside our blood, we have what we call the red blood cells that supplies the oxygen to all the body, all the system and organs of the body. Without oxygen, individual cannot survive. Without oxygen, individual is tend towards having a stroke, having a heart attack. We cannot even survive without oxygen. And also, inside this blood also, we have what we call the white blood cells. These are the cells that help us to fight infections. You can even know that now that we have the pandemic of COVID-19, one of the cells in the body, like lymphocytes, help us to fight these viruses, so that individual, it's not everybody that will come down with severe infections. So that means without white blood cell, we'll be sick, we'll be falling ill every time. Then we also have a component, another cellular component that we call platelets. That one helps us to secure hemostasis. Peradventure, maybe accidents, or you cut your finger, maybe while cutting, maybe onions or something else. Within a few seconds, that blood must stop. And it's because we have the platelets, which is also a component of the blood. So blood is life. Without blood, no human being can be able to survive.
Thank you so much. Now, we know that not even only human beings, animals, they have blood that run in their veins, and that's why they're able to survive. And just like you said, there are a lot of functions that that blood actually perform. So today we talk about the donation, the donation aspect of it. So you have a group of people, you're asking them to come around, to come and voluntarily donate. What do you do with the blood? I want to believe you are not a vampire.
I want to say that blood is very essential, as I have mentioned before. There are some people that require blood transfusion, probably, maybe through road traffic accidents, or any natural disasters, or during childbirth. Some people probably, they are bleeding, they require blood transfusion. Some people with some chronic ailments, like chronic kidney disease, because their kidney is already being compromised, they cannot produce enough erythropoietin that will drive the bone marrow to produce more cells. So you have some of these conditions. Some people have bleeding diastasis. They also, they bleed a lot, so you need blood to be able to give them to be able to survive. And if there is no blood in the blood bank, how will you be able to get? There is no way you're going to be able to get blood. And despite the fact that medical science, they have made us a lot of maybe breakthrough in managing diseases, as of today, there is no substitute for blood. Blood is being manufactured by human beings, and it's only human beings that can give blood. So you cannot go to the market and say you want to buy blood. And that's why we advocate that people should come and donate voluntarily so that we have enough of blood in the blood bank. Most of the time, people try to only donate when I have a patient or I have a relation that is ill that requires blood. That is when I go and donate. That is not good. That means
Okay. What's going on? Okay, sorry. Okay. Hello. Okay, so we're having some technical problem there. We can't hear you. Wow. Okay. Dr. Durotoye, we can't hear you again. There seems to be some issues there. Whoa. Okay. I think it might be your internet. Can you have a look at it? Right. Wow. Okay. Okay, viewers at home, if you can hear me, so sorry, I think we've lost Dr. Durotoye there. I'm hoping that she'll be, joining us back in a minute. So we're talking about blood donation and why it's important. I think she was trying to tell us about, what they do when people come in for, blood donation, or why blood donation is important, why they advocate that people should come and do a voluntary blood donation. So today being the World Blood Donation Day, what we know is, there are a lot of people that might be in need of, of blood in the hospital. There's so many situations that happen. It might be road traffic accidents. It might be, issues around the kidney. It might be some diseases. It might be people who, during the operation, they just lost a lot of blood. They need blood. So we need to have blood in the blood bank for us to be able to actually take care of these people. And sometimes, if we run out of blood, wow, it's completely kicked me out, I think. I think we're on completely. Reconnect. Hello?
Okay, I'm back. Sorry.
Yeah, that network is very, very bad. So
Yeah,
I will have
that's
to go
right.
back online. We were kicked offline, so I'm going back online. So we're going on. Right, sorry about that, our viewers. I think for some reasons we have very bad network today. So please bear with us. I think because of the weekend, a lot of people are going online. So sorry about that. You can carry on what you were trying to tell us, Dr. Idayat, Dr. Durotoye.
Hello, sir. I'm saying that blood is life.
Yes.
And there are some conditions in which we need blood. And for being a regular blood donor, voluntary blood donor, you are not looking for monetary gain. It means that when there is a need for blood for any emergency, it will be easier for us to be able to get this blood readily available. Instead of waiting for when you are going to donate as a family replacement, we don't want that. Neither do we want paid donors in which their blood is not even safe, because some of them, they do harbor HIV, they do have hepatitis B, hepatitis C, which can constitute a problem to the recipient of the blood. So being a voluntary blood donor is something that is very important. And you know that you are also satisfied that you are giving life to people. If you donate a pint of blood, at times it can save up to 3 lives of human beings that would have been lost. And for that, you are okay. You feel so good that you are saving people's life. So blood is very essential. And today, 14th of June, we are asking people to donate blood voluntarily without getting any dime from that.
That's amazing. So you talked about a pint of blood saving up to 3 lives.
Yes.
That's a huge impact.
Yes. Very important.
Right. So what does it take to actually make a donation of a pint? What does it take from an individual?
Okay. You know, if you want to donate blood, we try to put in some criteria into place, because we don't want that blood to constitute problem for you if you donate. So there are some criteria for blood donation. A female can donate like myself. I am a voluntary blood donor. You can see my cap. Likewise, a male can donate blood. We do use an age range between 18 years of age and 60, 65 years. We are choosing 18 years because no less than 18 years, individual is growing, you require iron, so we don't want to deplete you of iron. Then 60 years, 65 years also, because at the old age, there may be probably some comorbidity, maybe somebody is hypertensive, diabetes. So we don't want extreme of age. But in some other countries, in abroad, you can see some people up to 70, 80 years still donating, because they have been doing that all this while. So they are already used to it, their body is already used to it. So age range in Nigeria most of the time between 18 years and 60 years or up to 65 years if you are being a voluntary blood donor. Then there are minimum weights that we need from you, at least 50 kg. 50 kg, that's the minimum weight we require from you. Then the hemoglobin concentration of a donor is very important. That's what we normally do, a donor fitness testing. We must test you that you have enough, because if you don't have enough, you will not be able to give. It's only people that have enough that can give blood. So we try to take a minimum of 12.5 grams per deciliter for a female, then 13 or 13.5 grams per deciliter for a male to be able to qualify to donate. Then we also try to measure your blood pressure to make sure that you are okay, so that everything at the end of giving that blood, you will not have any problem. Because normally blood is supposed to be something that you give without any adverse effect to your health as a donor. So,
thank you. Okay, thank you so much for that. So, what people might be asking or might be thinking at home that, okay, right, I'm ready, I want to give blood, but I'm also scared because I don't know, this is my blood. So if I give the blood, am I not going to be depleting my own store, you know? And that might cause a kind of hindrance. Do you want to throw some light to that? Is there anything that we need to worry about around this?
I want to say that we put in some criteria in order, and we make sure we check all these criteria before we can take blood from any donor. I mentioned the age, between the age of 18. We don't normally take from anybody less than 18 years because we don't want to deplete them of their iron store. Then also, in patients that have maybe other comorbidity, cancer, lung disease, chronic sickle cell disease, bleeding diastasis, we cannot take blood from them. So we do put some, we always make sure that people that are going to donate are people that are fit, physically and hemoglobin-wise, so that they will not be depleted of iron store.
Okay, so now, when I come and I donate blood to, to the bank, so what's next? What do you do with this blood? Can we know what you do with the blood that we donate to you?
No, I said that there are some people.
Sorry, ma'am. I know that the end is for you to give to, to somebody who needs it, from like you've told us. But
yes,
during the process of I've donated it, what process does it take before it gets to the person? Are they paying to get this blood from you as well?
That's a very question. And this is the type of question I always expect, because people will claim that I'm donating this blood without taking a dime. Why are you people now selling blood? We don't sell blood at the blood bank. There's nothing like selling blood. But you remember that this blood, even before we take this blood from you, we are going to do certain tests to make sure that you as a donor, you are okay. We are going to check your hemoglobin. Then at times we take some small blood and check that you don't carry a risk to the recipient of the blood. We try to screen this blood. We screen for HIV. We screen for hepatitis B. We screen for hepatitis C. Even some centers, they screen for maybe Jacob disease, malaria, some parasite. All those ones cost because they're going to buy reagents to be able to do this. So if anybody is requiring for blood and we ask you to go and pay certain amount, which is very small amount, the amount of money you are paying is for the processing field, is for the screening of this blood for transmissible infection that we don't want the recipient of this blood to get. But we are not charging blood. We are only charging some few amounts for people for the test that we perform on this blood. So your blood is given, because no amount of money can replace what we have given you. But no, you are just satisfied that you have given lives to some people that are hopeless. So we are not charging. We don't charge for blood that you have given us free of charge. Whatever we are charging, just maybe some minimum amount, is just the processing of the blood to make it safe for the recipients of the blood.
Right. Thank you so much. I know when I was in the medical school, there are people that will come around in those days, they file up, they want to donate, but when they donate, they want to get some money back. So does it mean that that process is completely scrapped, or what is there? Is that still in process? Are you running a parallel program? Do you understand? Like, are
yes,
people still come? Yeah, okay, you got my question.
I want to say there are 3 types of blood donation. We have the one from voluntary, non-remunerated donors. We have family replacement donors, and we have paid donors. In fact, according to the Vision 2020, we want to make sure that this is year 2020 now, that all the blood we have in our blood bank have from voluntary donors, not from paid donors. We don't want paid donors because they are the one that will go about with all sorts of vices. They take a lot of alcohol, a lot of cigarettes, they humanize, so their blood is not safe. We are saying that for blood safety, Vision 2020 is saying that we must move towards getting all our blood 100% from voluntary, non-remunerated donors. We don't want paid donors. They still hang around because people are not donating voluntarily. You must believe that about 50% of Nigerians, we are fit to donate. But when you get our data, maybe 4 in 1,000 are voluntary blood donors. So that means at every point in time, we'll be short of blood. And people will just come around. We don't take it in our blood bank, but at times, no, it's not written on the face. Some of them will come and pretend to be the relation of the recipient of that blood. So, but we don't take from paid donors. And that's why today we are trying to advocate that people should come on board, be a saver of life, come and be a voluntary blood donor. And giver never lack. You will not lack good things because anybody can be a victim that will require blood donation.
Thank you. So it's a fantastic thing that you do. And I think I can relate with that. And I'm sure our viewers will also relate with that, because it's only when you are in an emergency situation that you can understand what Dr. Durotoye is talking about. When you have people who come in and they don't have, the capability to actually pay for treatment. Now, on top of it, they now have to look for a way of paying, exorbitant amount of money to get screened and then to get blood itself, which is life. Thank you. Now, there are some questions, but I'm going to talk, we'll do the questions later. There are still a few things I want us to just clear off of the air. Like, okay, so let's say people donate. I believe that the blood cells that we have, they have a lifespan, a period of time that it will just stay, that you can use it, and at some point it won't be useful again, and it expires. So how do you manage this? How do you prevent this happening?
Thank you. Most of the time, because of the type of the anticoagulants we use inside of the blood bag, the lifespan most of the time around 35 days from the common blood bag, the anticoagulant we use. So we do store this blood inside a refrigerator between 2 to 4 or to 6 or 8 degrees centigrade. And we make sure that we maintain that temperature. Because if you don't maintain that temperature, this blood can get spoiled. And in our setting, the requirement for blood is quite high. So hardly will you get your blood be expired, because the request for blood transfusion is always high. Some people, during childbirth, they just open tap. And in fact, some patients can require as much as 20 pints of blood. So there's no way the blood will get expired inside our blood bag. We do keep this blood very well inside the refrigerator within the temperature of 2 to 8 degrees centigrade, and we make sure that we maintain aseptic technique in collecting this blood. So if there's a request, immediately, because there are some requests that you cannot even be waiting for the relation to come and donate, like road traffic accidents, maybe femoral fracture. Some people can bleed up to like maybe 4 or 5 liters. How many liters do we have in ourselves? in our body that you will not, so at times you have to replace very, very fast. So most of the blood people donate voluntarily, they are being used to treat people that require this blood. They don't get expired most of the time. And anyone that gets expired probably, which is not too common, they are probably discarded. They are probably discarded.
Thank you so much. So, if I donate, if I come and I donate, does it pose any risk to me? I know we have asked a similar question, but people are asking, if I come to you and I donate, what risk do I stand in, or await that I need to be mindful of?
Blood donation supposed to be without risk. But you know, in life, one way or the other, there may be some maybe less than 1 or 2% that can have a serious maybe transfusion issue. But in actual sense, especially if there is proper donor selection criteria, individual that donate is not likely to suffer anything. Even if I told you are going to suffer just the needle prick, you know, no matter how, by the time I prick you with needle, you know, you just feel some minor pains. Otherwise, it's supposed to be like a free, very easy, within 30 minutes you are up. You understand? Right. But some people, especially a first-time donor, they can experience some maybe like fainting, mild fainting attack. And if it does happen, immediately, individual will be resuscitated. And that's why immediately after the donation, you have the doctors there. We monitor your blood pressure, we monitor your pulse, we communicate with you that are you doing well. If there's any issue, we'll be able to address that immediately. So by and large, I can say that in most instances, there is no any hindrance or any problem with the donors. Rather, you gain from donating blood. You gain a lot of health benefits from donating blood regularly.
Right. So what are the health benefits?
What are the
health benefits?
Yeah, let me say. As a voluntary blood donor, you are unlikely to have heart attack. You are unlikely to have heart attack. You are also unlikely.
How and why does that happen?
Yes, because you try to, even in our body, there is a lifespan for all these cells. The more you donate, the more you get renewal from your bone marrow. So you have the new cells in your blood system. So there is no maybe you have plenty that can block all these blood vessels. So by the time you donate regularly, you try to even remove some of this excess iron that can be a serious problem to the individual. So individual that donates regularly, even apart from that, coming for donation, we do certain physical examination on you. You check your pulse, because some people naturally they don't go for medical tests. But if you are coming for blood donation every 3 months, every 4 months, we check your blood pressure, we check your pulse, we make sure that you are okay physically, mentally, psychologically. So, if you have maybe blood pressure, we will be able to advise you appropriately. So, people that donate regularly, they have less risk of having heart attack. They also have less risk of having liver disease, because the only way you can lose iron from your body is through regular blood donation. And there are some conditions we call hemochromatosis, in which some people, they try to have plenty iron in their body, and this iron can damage vital organs. It can damage adrenals, it can damage liver, it can damage any vital organ. So by the time you donate regularly, and we try to remove part of this iron, you know that you are safe from heart attack. It also makes you feel good. It makes you feel, you even look good, because every time you donate, your blood Your bone marrow is replenishing the one you have donated. Within 2 to 3 months, you are back to your normal hemoglobin level. And also, it will also accelerate wound healing. In case you have wound maybe infection or any sort of maybe any injury, it do allow you to heal this wound very well. And also, it make you feel fulfilled. No, psychologically, I have saved lives. Because some people, if there's no blood, within a few minutes, they can die. But for your blood to be able to save life, psychologically, you will feel fulfilled that, I am a saver of life. So many advantages for you as a blood donor. Psychologically, even in time of your health.
Thank you so much. That's quite explicit enough, because that's one thing that might be pondering people's mind. Like, why do I have to go? But like you've heard from Dr. Durotoye, it's very, very good, to do this, because you also benefit from it. A lot she has mentioned, and I'm not going to go around there, psychologically and from your physical health as well. The fact that you're clearing certain things from your body that might actually cause harm, but by way of giving out, you're saving yourself that havoc. So there's one question that somebody asked here. Well, I think you've answered it, but because it's been asked, maybe they didn't hear. They said, "Is blood donation painful?"
It's not painful, just the needle prick, which is not even as painful as when you have weakling. So just a needle prick. It's just a needle prick. That's the only pain you are going to have.
Right. So you've had just a small prick, and then from that prick, you don't feel much.
Immediately, within a few seconds, you not even remember that somebody has pricked you.
Yeah. Okay.
Especially when you have a very good pain.
Right. So there's another question here, says that, does donating blood weaken immune system?
No, rather it boosts your immune system. It makes you even to look younger than your age, because from your bone marrow, you are challenging this bone marrow to continue to work and replenish the aged or the old cells. So your bone marrow is producing, is working, and also your psychologically, you are also working, your brain is working, all your vital organs are also working. It does not affect your immune system. Because for you to even be qualified to donate, it's because of good nutrition that you have. You are already not depleted of iron, you are not even depleted of essential amino acid. So good food, I will advocate that you take good food, then you take your antioxidants, especially when you are 40 years and above. So it does not impair your immune system at all, because your lymphocyte is also being produced on daily basis.
Right, okay. I think this person is still asking question that, because I'm donating my white cells, does that affect my immunity?
Oh, your immune system is okay. It's
right.
Even making you not to age too early.
Right.
Your weight, you're going to have a normal weight, you are going to have a normal blood pressure. No, you monitor your health, because during the blood donation, physical examination will be done for you.
Okay, thank you so much. Then how often can one donate? How frequently can one donate?
Yes, thank you for that question. Very important, because we don't want to deplete you as a donor of essential iron. It is advised that for a male, you donate every 3 months.
Okay.
Then for a female, because of menstrual, maybe lactation, breastfeeding, all sorts, we can advise you to donate either 3 times in a year for 4 months, or twice in a year. But for a male, you can donate up to 4 times in a year, or you make it maybe every 4 months. Then female, every 4 months, or every 6 months. So you can donate up to 3 or 4 times in a year as a male. Then as a female, you can donate 3 to 2 times in a year.
Okay, thank you so much. Now, somebody is asking about some, grouping in the body? Does it have any effects? If I'm resource negative, I'm resource positive, ABO, does it make any difference for me to come and donate?
No, because naturally, either you are blood group A, blood group O, blood group A and B, or blood group B. Any one is useful. Any of the blood group is useful because not any of the patients can be either of those blood group. So any blood group can come and donate. Any blood group are welcome to the blood bank.
Okay, thank you so much. So how have you been creating this awareness? If it's not today, which is the World's, Blood Donors Day, is there any awareness in Nigeria, any awareness program that we need to be aware of that people can actually join or support in terms of advocating this laudable service?
Yes. Normally, even in my Department of Hematology, University of Ilorin Teaching Hospital, we go on routine campaign to schools, to marketplaces, to churches, to mosques for people to donate. We do that often. We don't normally wait until 14th of June before we go out. Even like this Club 25, now those people, they are youths and between the ages of 18 and 25 years, and they promise that they are going to donate blood about 25 times before 25 years of age. So youth, they go, even some of them on their own, they come to the blood bank, the students, governments, and we want to save life. We want to come and donate. So we do advocacy. We go out to make campaign for people to come and donate voluntarily. Even within the hospital at times, if not because of the coronavirus pandemic, today you will see us all over. Even the Medical Women Association of Nigeria also advocating that people should go and donate voluntarily. And also today, around 1 o'clock, our Minister of Health was on live broadcast about blood donation. So a lot of advocacy, a lot of students, governments, voluntary organizations, NGOs, they go, they advocate for voluntary blood donors. We want people to donate voluntarily. So it's not only today being June 14th, but today is just being set aside to appreciate our voluntary blood donors. We must appreciate them, and we encourage people to also come on board to be a voluntary blood donors.
Thank you so much. So I think we're getting to the end of the program. What is your advice generally? I would say let's split it into two. I know we've talked a lot around, we now know what blood donation is all about. We know the processes that we take for blood donation. We know how you screen our blood. We know that, you store this blood for a period of time. We know that a lot of the bloods do not get spoiled. We know that, people get the blood when they need it. So in terms of the process, or let's say, what will you advise the public generally to encourage them to support this program?
I want to say that blood is life, as I've said earlier, and also there is no ideal substitute for blood. So that means if an individual needs blood, you can only get it from another person. And in view of this, in view of the fact that nobody is immune against any ailments, nobody is immune against any disaster, anything can happen to anybody. So be a voluntary blood donor, you will never lack. And even you have an advantage. We do give you a donor certificate because you can donate today, maybe if your relation now falls ill, you cannot donate again immediately because you've just recently donated. But for you having a donor card and you just tender this to the blood bank, immediately people will come to your rescue. They are going to make blood available for your relation. So it is said that giver never lack. If you donate, there's no way God will not be with you when you need any help. The help can be in any form. So if you donate blood voluntarily, God will be there for you. So I want to advocate that if you are 18 years and above, you can come to the blood bank of University of Ilorin Teaching Hospital or any other blood bank. Even in Nigeria, we have National Blood Transfusion Services. We have in Lokoja, we have in Ekiti State, in Abuja, Lagos, Abeokuta, in the East, Enugu, and so on. Any of those areas, you can just go there and go and donate. You donate today and be a regular donor. Want a regular blood donor. Want somebody that will know that every 3 months, I already have a course that I must go and donate blood. Let's join what is going on in overseas. Let's join that we want to maintain 100% voluntary blood donation. This Vision 2020, let's be a part of it.
Right. Oh, by the way, you keep talking about Vision 2020. What is Vision 2020 really? Because I think
Vision 2020 is towards attaining 100% voluntary blood donation.
Right.
Because
okay.
We want everybody to be a voluntary blood donor. We don't want paid donors. We don't want family replacements. We don't want people that will harbor HIV, they will harbor hepatitis. No, we don't want that. We want people that are voluntary. No, because most of these voluntary blood donors, they are the people that they try to guide their heads. They maintain healthy lifestyle. They don't humanize to be able to catch HIV or hepatitis. They don't drink, they don't smoke. So that's the purpose. Everybody is talking about Vision 2020 towards 100% voluntary blood donation. So as to maintain blood sufficiency, blood safety in our various blood banks.
Thank you so much.
And we are 2020 now, so please be a voluntary blood donor.
All right. So viewers at home, obviously you can hear this, and I'm sure that you're connecting with this vision. There is need for us to pull our hands together, pull our hearts together as well, in the mind of supporting people who will be in need of blood. So try and be part of this great vision. There will be there will be a blood bank close to you. So all you need is to just walk in there, make yourself, available, and then all the necessary tests can be done. And if you fit in, then that will be on the path to saving at least 3 lives. Because like we heard earlier on, 1 pint of blood, which is what you donate when you go, can actually save 3 lives. Thank you so much, Dr. Durotoye. So any advice for the government as to what we can do to support this laudable, life-saving program?
The government on their own part to try to help us publicize this, and also to be leadership by example. The wife of the executive governor of Kwara State today is also advocating for people to go and donate. Everybody should join this campaign. And all they require, maybe in terms of supporting the blood banks, the government should be able to help us in doing that. Because there is nothing, even when you go on campaign, you spend some money, even some, especially when you are dealing with students, they like to, like this face cap, we do produce it. It's money, you give them t-shirts, the sense of belonging. By the time they get back to their class, they will even be doing shakara that, see me, I am a voluntary blood donor. And this one also requires money. So we just want the government, they'll be doing their best. And we want them to continue to do the best so that we can achieve the Vision 2020 towards 100% voluntary blood donation.
Thank you so much for coming to enlighten us about blood generally,
and about blood donation, and especially today, enlightening us on Vision 2020, which is the goal to achieving 100%, voluntary blood donors in our banks. And to the viewers, thank you for being patient. Thank you for staying with us. And we're really sorry for the connection issues that we have. I think because it's a public, it's a weekend. A lot of people are connecting there. So the whole thing is a little bit draggy. Thank you. And we look forward to meeting you again in the next program, which is coming on Thursday. Dr. Durotoye, we really appreciate you. Thank you so much. And see you another time.
The moderator.
Cheers.
Peaceful
Bye-bye.
night.